If you could get an important message about your health every single day, would you read it? Well, guess what? You already do. But most people ignore it. Guess what I'm talking about? I'm talking about your poop. Yep, that daily delivery in the loo is actually your body's way of dropping hints about your health. Ignore it, and you might just miss an early warning sign of a serious issue. But don't worry, I'm Dr. Onye, and I'm a family physician and medical educator. And today we're decoding the mysteries of your number twos, because knowing what's in the toilet might just save your life. And if you love learning about how your body speaks to you in ways you've never realized, make sure you hit that like button and subscribe for more eye-opening health insights. Let's dive in. All right, now, first things first, what does normal poop even look like? A healthy stool should be sausage-shaped, smooth, and medium brown. You should also be going anywhere from 3 times a day to 3 times a week. Yes, there's a range, and your normal might not be someone else's normal. But if your trips to the toilet are taking a weird turn, that's when your poop might be trying to tell you there's something going on. So let's try and decode it. Now let's talk about pale or clay-colored poop. If your stools look unusually light, almost like potty, chalk, or even wet cement, then it's often a sign that your digestive system isn't getting enough bile. Bile is what gives poop its healthy brown color, and is produced by the liver and stored in the gallbladder before being released into the intestines. When bile isn't flowing properly, it could mean there's a blockage somewhere in the bile ducts. This might happen due to gallstones, liver infection, or even pancreatic issues. Sometimes conditions like hepatitis or cirrhosis can even cause this. Now, before you panic, think about your recent meals or medications. Antacids or certain medications can sometimes lighten your stools temporarily. But if it keeps happening, especially if it's paired with symptoms like yellowing of your skin or eyes, aka jaundice, pain in the upper right hand side of your abdomen, or dark urine, you really need to see a doctor. Bile isn't just important for your digestion, it's a window into how well your liver and gallbladder are working. So if your stools are looking pale, don't ignore it. All right, let's talk about black poop. This one can really catch you off guard. So if your stools are looking black or tarry, it could be a sign of digested blood from the upper part of your digestive tract, like your stomach or small intestines. And this is often called melena. It happens when there's bleeding from a condition like stomach ulcers, gastritis, or inflammation of the stomach lining, or even what they call esophageal varices. And these are swollen veins in the esophagus that can bleed. Now, before you jump into conclusions, let's take a moment to think about your diet. Have you had anything dark in color recently? Foods like blackberries, licorice, or even rich Guinness stout can temporarily darken your stools. Similarly, taking iron supplements or bismuth-containing medications like Pepto-Bismol can turn your stools black, and that's nothing to worry about. But here's the key. If your stool is not just black, but also sticky or tar-like, it's worth paying attention. That's a big clue that blood has been sitting in your digestive system long enough to change color. You might also notice other symptoms like fatigue, dizziness, or feeling faint. And these are signs of anemia from blood loss. The bottom line, if black stools appear out of nowhere and doesn't have any obvious cause, or is accompanied by symptoms like abdominal pain, weakness, see your doctor straight away. Early detection is crucial, and simple stool tests or camera tests can even help find the source. Remember, your gut doesn't keep secrets for long, so listen when it speaks. Seeing red in a toilet bowl can be shocking, but don't panic just yet. There's a lot to consider. Bright red poop or red streaks in your stools usually point to bleeding somewhere in the lower part of your digestive tract, like in the rectum or the colon. This can happen because of things like hemorrhoids. These are swollen veins in the rectum. Anal fissures, which are small tears in the skin in your back passage, or conditions like diverticulitis, and this is inflammation of the small pouches of the colon. But before jumping into conclusions, take a moment to think about your diet. Have you had any beets, tomatoes, or anything with red food dye recently? These can colour your stools in ways that looks dramatic, but is totally harmless. For example, beetroot can make both your stool and your urine take on a reddish tint, something many people don't realize until they've had a mini heart attack in the bathroom. Now, if the red stool is persistent or you notice blood mix into the stool itself and not just on the surface, that's when it becomes more concerning. It could point to more serious conditions like colorectal polyps, inflammatory bowel disease such as Crohn's or ulcerative colitis, or even colorectal cancer. Other clues to watch out for include abdominal pain, changes in your bowel habits like diarrhea or constipation, or unexplained weight loss. These are signs that you really should see your doctor straight away. Early intervention can make all the difference when it comes to treating digestive issues. So, what's the takeaway? Not every red stool is a reason to panic, but if you're concerned or it comes with other symptoms like I spoke about, don't ignore it. Your body's trying to get your attention for a reason, and it's always better to get things checked sooner rather than later. Now, has your poop ever looked green? Seeing green poop can be surprising. Most of the time, it's because food is moving too quickly through your digestive system, so bowel doesn't have time to break down properly in order to turn your poop brown. It can happen after eating lots of greens, like spinach or foods with green colouring, but if green poop sticks around for a few days, especially with diarrhea or stomach cramps, it means your gut is irritated, possibly from a stomach bug or irritable bowel syndrome. If it's just your diet, no worries, but if it doesn't clear up, check it with your doctor. Okay, so let me introduce you to the Bristol Stool Chart, a visual guide that's basically a poop personality test. There are 7 types, but here's a quick breakdown. Type 1 and 2 are hard and lumpy. These are signs of constipation. If this is you, drink more water. Eat fiber-rich foods, because that will definitely help. Type 3 and 4 stools are the gold standard. Smooth, sausage-shaped, easy to pass, and if it's your poop, then great. Your digestive system is winning. Type 5, 6, and 7 are loose, mushy, watery stools, and this usually means diarrhea, which can be caused by anything from a spicy takeaway to infection. And if it lasts more than a few days, then it's time to call your GP. When it comes to poop, how often is normal? The truth is, there's a range. Some people go 3 times a day, while others just go 3 times a week, and both can be perfectly healthy as long as it's consistent for you. But what happens when your frequency suddenly changes? If you're not going as often and find yourself straining, well, that's probably constipation. And this can be caused by dehydration and a lack of fiber in your diet. Long-term constipation could point to something like thyroid issues, irritable bowel syndrome, or other bowel conditions. As a good rule of thumb, drink more water, eat more fruits and vegetables, and get moving. A lot of people don't know this, but exercise can actually get things flowing too. On the flip side, if you're going multiple times a day and it's loose, watery, that's probably diarrhea. Common causes include a stomach bug, food intolerance like lactose, or even anxiety and stress. That's probably why back in med school, exam days seemed to send me to the toilet way more than usual. If you've had similar experiences, drop a comment below. I'd love to know I'm not the only one. But if diarrhea is persistent, it could be a sign of a deeper issue, like Crohn's disease, colitis, infections, irritable bowel syndrome, or even celiac disease. So while your frequency doesn't have to match anyone else's, big changes are worth paying attention to. Your gut knows what's normal for you, so listen to your gut when it's out of rhythm. All right, let's talk about the smell. Because let's be honest, no one's poop smells like roses. But if your stool smells unusually foul, it could mean your body's not absorbing nutrients properly. Conditions like celiac disease or pancreatic issues can cause this. Also, keep an eye out for floating, greasy poop. It might mean your body isn't digesting fats properly, which could also point to pancreatic issues or gallbladder problems. Okay, so as a doctor, I always like to know about mucus in your poop. A little mucus is normal, it helps things slide along smoothly, but if you're seeing a lot of it, especially with blood or diarrhea, it could mean inflammation in your gut. It's worth seeing your doctor to do some simple tests to find out what's happening. Now let's take a moment to talk about your diet, because what you eat has a big impact on your gut health. Diets heavy in processed foods, fast foods, or sugary snacks can slow things down and often lead to constipation. while greasy, fatty meals might cause loose stools. And if you're lactose intolerant, even a slice of cheese can send you straight to the toilet. And same goes for gluten if you're sensitive or have celiac disease. For a healthier gut, focus on fiber-rich foods like oatmeal, berries, beans, leafy greens, and don't forget to drink plenty of water. A balanced diet keeps things moving and your gut will thank you for it. So there you have it. Your poop isn't just something to flush and forget. If you have any concerns, don't just sit in it, literally or figuratively. Your poop can give you a little health report, and paying attention to it can help you catch potential problems early. Now, if you made it this far into the video, thank you so much for sticking with me. Drop the word poop in the comments below, and it'll confuse everyone else that didn't make it this far. And I'll be sure to give you a thumbs up for hanging in there till the end. And let me know if there's any other health topics you'd like me to cover. As you can see, nothing is off limits here. Don't forget to like, subscribe, and turn on notifications, as there's plenty more where this came from. Because next, we'll dive into what other parts of your body can tell you about your overall health. Until then, take care of yourself and your gut. See you in the next one.